Here's the scoop. Here's what I know about iTero. I've been teaching scanning for, God, 20 years. I've test-driven every scanner on the market. What I know about iTero's history is this. You and I, we know this guy mainly for Invisalign, right? It's been an orthodontic scanner, and that's the lineage of iTero. But what I've learned about iTero over the last maybe 8 months or so is that it's a tremendous restorative scanner, right? So we can use this in our practice in two main different ways. So pre-case acceptance, it's a tremendous teaching tool. I love it, right? Because we can put this in the hands of our hygiene team, our assisting team, and my hands too. And we can track historically where a patient's been with things like occlusion. We can look at tissue, we can look at recession, we can look at wear patterns. And that's all about helping you and I get our patients to understand what we know is really important to them and educate. And then on the post-case acceptance side, again, like you guys know this for scanning for Invisalign, and that's an awesome tool. But it's an equally awesome tool when we start talking about traditional restorative dentistry. So dentists all over the world are using this to scan for simple crown and bridge. They're using it for dental implants. They're using it for occlusal guards. I'm guessing we can probably hook this up and we can 3D print and we can mill and do all sorts of things in dentistry that we're doing in lots of different spaces. So it's a really cool tool. And I'm gonna be a jerk right now because the last scanner I bought 20 years ago, I made somebody jump in the chair with, you game?
Yeah, definitely.
Yeah, so let's see how it works. Just do new scan. Let's scan. All right, guys, from my limited knowledge, I'm gonna work from posterior to anterior. I'm gonna get my lingual. I'm gonna do a little rocking and rolling. And then I'm gonna come to the other side. It's pretty fast, super fast actually. I'm gonna rock and roll. Now I'm just kind of playing, so I apologize in advance, but you know, it's super fun. I will tell you immediately my first favorite feature is the fact that there's a button on either side of this scanner. So I can turn it on and off with my thumb or my forefinger. That's kind of cool. And I know I'm clearly doing this sort of against the process, but I'm doing this on purpose because I want to see what it does. And I'm doing this sans retraction, sans obturgates, sans everything, but I know I'm a rookie and that's my first scan and I've got some blue clearly to fill in the blanks, but that didn't take very long to get us to that.